Good afternoon, everyone, and welcome to the FDA Alumni Association Speaker Series. My name is Freda Schiavolenti. I will be your moderator today. I am currently the Vice Chair of the FDA Alumni Association. Just one little point of housekeeping. If you have any questions, please put them into the Q&A, and John will be getting to them at the end of the presentation. A little bit about John. John is the Deputy Director for Import Operations Enforcement in FDA's Office of Enforcement and Import Operations. He provides leadership and oversight to a field operational staff of more than 700 FDA investigators, supervisors, support staff, and compliance staff. He oversees all aspects of FDA's import operations, including investigation and enforcement activities and interagency collaboration. Throughout his 31 years with the FDA, John has specialized in import operations. He spent his first 14 years in FDA field offices in Dallas District and Chicago District, primarily as an import investigator, and was named FDA's Inspector of the Year in 2000. John has been a member of the National Instructor Cadre, responsible for training employees on import law and FDA import procedures since 2001. From 2004 to 2021, John was a staff member, manager, and ultimately director of the Division of Import Operations. He became Deputy Director for Import Operations Enforcement in April 2021. I will now pass this over to John Verbatim so he can give his presentation to you. Thank you, John, for doing this for us.
Thank you very much, Freda, and thank you all for having me here today. Again, my name is John Verbatim. Freda gave a nice introduction. I was just thinking about what she had said, and it was within the past couple of years, I think, that I flipped over from having spent the majority of my career in field operations to now having spent the majority of my career here at headquarters. And while that may sometimes cause me a little pain here, this is the life we chose, as we like to say. And I'm eternally grateful for the opportunities that I've been able to have here with FDA. Again, I appreciate the opportunity to meet with you all today and kind of talk about what's been going on here at FDA with our import operations and being done here in the Office of Regulatory Affairs. Things are very different than perhaps some of you who are familiar with import operations may remember. And hopefully, I'll be able to express some of those, what's been going on, what we did during the pandemic, and what we're looking at going forward with import operations. And for those of you who perhaps aren't as familiar, hopefully provide a little bit of background and some education, let's say, on what goes on here in FDA with our coverage of products of foreign origin. Freda, I know I said that when we were going through all of this that I wasn't going to have an actual presentation, but once I started going through everything to share, I did throw something together. So I'm going to try to share my screen. You let me know if I've totally mucked up the works. All right.
Go for it.
Oh, or maybe I won't be able to. It says it's disabled. All right. Well, what I can do then is I can go through what I have. And then ultimately I can share it and it can be passed around if folks want it.
Well, I'm going to see if Angela can possibly help. Angela, I don't know if you're still online. If there's a way for you to allow John to share his screen, please. No. Okay. John, please go ahead.
Okay. So what I wanted to talk about first off is just a basic imports 101, kind of the world we're working in now here in import operations within the Office of Regulatory Affairs. So just to kind of set the stage for us now is back in 2017, the Office of Regulatory Affairs we reorganized within ORA and went to more of a programmatic setup as opposed to the district setup. And under program alignment, the Office of Enforcement and Import Operations was created. And this now encompasses all of our import operations and the enforcement that we take in that particular realm. We have at our headquarters component and overseeing the program as a whole, we have an assistant commissioner for import operations, Mr. Dan Solis, who some of you may know from his time in the old Los Angeles district, and as the director for the Division of West Coast Imports.
Hey, John,
Yes.
I just learned that possibly you will be able to get on. You now have our co-host.
Oh, well,
So
how about-
please try to share. And someone just mentioned your volume seems to be going in and out, which I'm seeing that also. Oh, good. Thanks, John. You got it.
Okay. Hold on a second. I want to. And I will try to move around less. I think that seems to be what the problem is for me with the volume. I tend to rock back and forth, but you keep telling me if you're not able to hear me well. So as I was mentioning, excuse me, this is kind of our organizational structure. We all report up to Dan, who reports directly to the ACRA. I am the deputy director within the Office of Enforcement and Import Operations, and I'm the deputy for Import Operations Enforcement. Under my purview are the 5 field divisions within the import program. These divisions are located geographically. You may know some of the names here of the different division directors that we currently have for our 5 divisions. We also have another deputy, Dr. Fayad Rahman, and he is the deputy director in OEIO for targeting analysis and support. And he oversees our 2 main headquarters components, the Division of Import Operations, who's headed by Allison Nicoli, and then our Division of Food Defense Targeting, who some of you may have remembered as the Prior Notice Center. And that's Kelly Giannatasio. As I mentioned, we are split up geographically, so this is what the map looks like, or at least one of the maps that we have for import operations. We have our Division of Northern Border Imports, which we like to say is from Blaine, Washington to Maine, so from Blaine to Maine, and that's headed up by Keith Jassikaitis. We have our Division of Northeast Imports, headed up by Captain Nazmul Hassan. We have Division of Southeast Imports headed up by Ruth Dixon. An interesting item about the Division of Southeast Imports is we specifically and intentionally created one of our divisions to cover courier operations. So FedEx, UPS, DHL, they all fall under the Division of Southeast Imports. So if you happen to notice the colors here, you'll see that the state of Alaska actually falls within our Division of Southeast Imports. And that's because the FDA personnel we have in Alaska are there to help provide oversight to a FedEx hub in Anchorage, Alaska. And so to maintain that level of coverage and that consistency and oversight, even though it's not exactly in the southeast of the US, they do fall under DSEI. Then we have the Division of Southwest Imports headed up by Todd Cato. Many of you may recall SWID. It's basically the same setup. Todd was probably the least affected of everybody in program alignment because his division remained exactly the same. And then we have the Division of West Coast Imports, which is now headed up by Dr. Kathleen Turner. Here's another way of looking at basically the same map. So when we talk about imports, imports has been, like, as you can imagine, an absolute growth industry. And it's whether it's for FDA regulated products or any other kind of products, imports just continues to grow and grow and grow. And as you can see from this chart, it's pretty steady. It's actually, we can forecast pretty well that in any given year, we're going to have about a 5% increase in the number of import lines that we have to deal with any given year. I expect that if not this year, then in FY23, we will go over that 50 million lines mark. And I think back about when I was in the field back then, 20 years ago, we were at about 10 to 12 million lines of product being imported that FDA regulates. And so it's just going to continue to grow. And we expect that going forward. You'll see there was a bit of a dip in FY 2020. That obviously was a result of the pandemic. Actually, what we noticed was the majority of that dip there is accounted for in about the first 3 to 4 months of the pandemic. And then everything just kind of went right back up to where it normally is. Of those 40 some odd million lines of product that we encountered last year, again, these are all products, regulated by FDA. For imports, it's the same jurisdiction that we have for our domestic authority. So foods, drugs, medical devices, cosmetics, veterinary products, drugs and biologics fit into there, of course, as well, tobacco products and radiation emitting products. If it's imported, it falls to the import program for us to do our regulation at the time the product is imported. For the last, I want to say 6 or 7 years now, medical devices has been the highest volume in terms of lines. They overtook foods back then, but human foods obviously maintains a large segment of the FDA regulated products imported into the US. Now, you've heard me mention lines a few times, and I want to give a little background here. For FDA, for the import operations purposes, we gauge our volume, let's say, in terms of lines. And you can consider lines to be a distinct shipment of a particular product. We can't really gauge things based upon other measures because, quite frankly, there are so many other measures out there that can be used when products are imported into the US. For example, for foods, we could get measures in, say, kilograms of, let's say, peppers that are being imported. So many kilograms are coming into the country. But that same shipment could also be broken out in the number of cartons of peppers that are being imported, or quite frankly, someone could give us the number of peppers that are in that shipment. And for us to try to bring all of these different data points in this way and try to come up with, well, it's this many kilograms of peppers, or this many peppers have been imported across the entire year, it's just not doable. So we look at each discrete shipment of those products. So I can tell you how many shipments of peppers were received into the US that we had to make decisions on. Another way of looking at it, an analogy we like to use, is if you go to the grocery store and you buy some peppers and you also get some aspirin and a carton of ice cream. When you go to check out, you're going to put all of those items in a bag, right? And go home with it. That bag, metaphorically speaking, would be what we would consider an entry. All of these different products that are together. And then within that bag, there are 3 lines of products: the peppers, the aspirin, and the ice cream. And so for the imports purposes, if that shipment comes in and it's got 2 cartons of ice cream or 2,000 cartons of ice cream, for our purposes, it's a line of product that's coming in. It also works well.
John, sorry, I have a question.
Sure.
So I see you have animal feed broken out. I see devices broken out. How would you categorize a veterinary device? Would you lump that in with devices?
At this point, they're lumped in with medical devices. We still don't have a firm grasp on the whole concept of veterinary devices. And so they would be coded along those same lines, and we use the FDA product codes to help us with those.
Thank you, John.
Determinations. You bet. So counting by lines also fits for FDA because each of those lines ends up representing a decision that needs to be made by FDA. And ultimately, our decision is, can this product come in the country or not? And we make a lot of those decisions every year. Last fiscal year, it was north of 45 million times we had to decide whether a product would come in the country or not. So we'll talk a little bit about the import process. First step in imports and initial jurisdiction and authority over anything imported into the United States is with U.S. Customs and Border Protection. So entry is made, or entry is filed with Customs and Border Protection. And we've worked many decades with Customs and Border Protection. We have our electronic data systems set up to communicate with each other and to help identify the products being imported that are FDA regulated. And so if Customs and Border Protection system identifies that the product is FDA regulated, that electronic entry information is sent over to FDA. Additionally, for foods, human and animal foods, there's a separate step where prior notice has to be provided back and is assessed by the Division of Food Defense started. Now, when this entry comes into FDA's system, it initially goes through an electronic screening process. And this is an automated process that happens to 100% of the imported products that FDA regulates. So we will always be very sure to let people know that everything that gets imported that falls under FDA's jurisdiction is assessed by FDA to determine whether or not it can come into the country. We use an electronic screening tool called Predict, which has been in use now a little bit more than 10 years, and is something that continues to evolve as we learn. We try to get a more effective screening system in place, and quite frankly, is one of the most advanced types of these tools that are out there. We get inquiries from foreign governments on a regular basis wanting to talk to us about our system, what goes into it, how can they put something together that works the same as they're looking to handle their volume of imports as well. Predict's been a real, it's been 10 years plus, but it was a game changer then, and it continues to be for us today. Because as you can imagine, again, with more than 45 million lines of regulated product coming into the country, we simply do not have enough staff to make that many decisions on our own. We need the ability to screen, target, and process these entries in an automated fashion to make us as efficient and effective as we can be. And so I want to say that roughly 2/3 of the products that are imported into the US that FDA regulates end up being released by FDA's screening system. It runs through the algorithms, it checks various data points for every product. It's looking at overall risk factors, import alert information. For products where it's required from the manufacturers, we're going to be looking at registration information for the suppliers, listing, pre-market notification, pre-market approval, things of that nature. And the system, goes through, it does its work, and makes that initial decision as to whether the product can be released, may proceed into the country, or if it's going to be held for manual review. If we get to manual review, this is our entry review function. Now, this is your consumer safety officers and consumer safety inspectors within the import program. They are going to look at this entry information that's submitted over into our electronic system, and they're going to start making some of those same decisions. So again, they're looking at the data that's there. They're looking at the results that come back from Predict. Predict, even though it holds the shipment, can make recommendations to the entry reviewer, recommending a release, recommending sample collection, recommending detention, or recommending some other type of action. Our entry reviewers will take this information along with what's in the system, their historical knowledge, and then they're going to make that next decision. And they can decide that everything seems to be okay, and we're going to let that product go, and they'll issue a release on their own. We may decide that we need more information. We want to get documentation for the shipment over and above what we have in the electronic system. We may decide that I need to have somebody go take a look at the product or collect a sample of the product for analysis. Or we may decide that we already have enough information to detain the product and not let it proceed into the country. And I'll talk a little bit about these different decisions of what goes on. So that first decision in the admissibility process is the entry reviewer may decide, or the system may decide to issue a release or give a may proceed to the product. That product is free to come in the country. Importer takes possession. They may distribute the product in U.S. commerce. It is still an FDA regulated product. FDA still has jurisdiction. And if it turns out later that there's an issue with the product that we didn't catch at the time of entry, we can take other action as needed. And we have been known to do that. But we do a pretty good job, so it doesn't have to happen all that often, thankfully. Something else that we might do is may decide that we need more information about the shipment. We want to go and take a look at the product, get eyes on the product. Our CSOs and CSIs, we train them in examinations of sample collections. Folks are trained how to spot evidence of filth, the decomposition. We can look for labeling issues, packaging defects, things of that nature. Or we'll collect samples. We have, very large surveillance sampling programs as well as for-cause sampling issues. We'll also have assignments, import bulletins, things that might drive us to increase our surveillance in different ways. All of these samples will be analyzed by FDA laboratories across the country. And whether it's the examination or the sample collection, the results of that activity are then going to drive the next decision in the process. If we find evidence of apparent violations, and this is important for imports, our standard of evidence is the appearance of a violation, which you can contrast with other sections of the Food, Drug, and Cosmetic Act, which are looking for the preponderance of the evidence in support of a violation. For imports, the standard of evidence is appearance of a violation. And so that helps us. I always say that this is a gift to imports from Congress because this helps us be a little more nimble and help set up other aspects of our import program where we don't necessarily have to have direct evidence of every shipment if we encounter issues there. But if we do meet this standard of the appearance of a violation, then our compliance officers will get involved and they'll issue a detention for the product and send a notice, as we're required to by law, to the importer and consignee explaining the action that we're taking and why we're taking. Of course, if we don't discover any apparent violations, we'll end up giving a release and the product can be distributed in U.S. Now, if we do detain the shipment, the importer can provide testimony to FDA to overcome the appearance. We call this the detention hearing process. The importer can try to provide us information to tell us, you know what, FDA, you're wrong, right? Our product isn't violative. Here's some, analytical results to show that the product is good, or you maybe have misinterpreted something. The importer can also submit a request to recondition, which is to correct the problem. They basically say, okay, you know what? My product is misbranded. It's not labeled correctly. Here's my plan to relabel the product so that it can be released. And if everything goes along those lines and everything checks out, then we can go ahead and release that product. We've corrected the violation, and now we're ensuring that a compliant product is being released to U.S. consumers. But if the importer is not able to overcome that appearance of a violation, we will end up refusing admission to the product. A little more about detention. Detention is often different for FDA than what a lot of people may think. Detention often gives a connotation that a product is being physically held at a particular place by a particular party. For FDA purposes, detention is more of an administrative process. And specifically, the Food, Drug, and Cosmetic Act allows the importer, the owner or consignee, to take possession of the articles as long as they have a bond in place with Customs and Border Protection. So again, our detention, our FDA detention, is not a physical hold of the product. If we refuse admission to the product, the importer has to destroy the product unless they export it out of the country. And it is their right. It's been determined in the courts that they have the right to decide which it is. They have to do that within 90 days. If they do not comply with this requirement, because they do have a bond with Customs and Border Protection, they can be subject to liquidated damages 3 times the declared value of the product. Now, if we have a violative product that's of significant concern, we want to do more than just say, issue liquidated damages for 3 times the value of the product. And like I said earlier, we still have jurisdiction over the product. And there are other steps we can take if we need to go for judicial seizure or take other action. We can do that if the concern is there. So that is very quickly, and hopefully it felt quick, the import process. One thing I do want to touch on, because it's a big area for FDA, especially in light of the opioid crisis here in the U.S., is we've really expanded our work in the international mail facilities. For those of you who are familiar, and here's some pictures of our FDA staff. And if you look at the upper right-hand corner behind our investigator, all of those boxes contain drug products. And it is what I often refer to as an ocean of packages entering the U.S. containing drug products. And in order to do our part to help with the opioid crisis, we were provided many different authorities by Congress that have expanded upon the work that we're able to do in the international mail facilities. I spoke of the refusal process and the importer having the right to decide whether they were going to destroy the product or export it out of the U.S. Well, under the Food and Drug Administration Safety and Innovation Act, FDA was provided the authority for drug products specifically valued at $2,500 or less. So this was geared towards those things coming in through the mail. FDA can now decide this product will be destroyed. And we have really leveraged that authority. We're at, last year, at 86% of the drugs that came into the US through the mail that we refused, we ended up destroying. And we're looking to increase that even more to the tune of, I think the number is 36,000 different drug shipments coming into the mail last year. We caused the destruction. We recently had that authority extended to medical devices as well. And we're working through our steps to get to that point where we're going to start doing that. We've got to update our regulations before we actually implement it. But we should be able to get that within the next fiscal year or so. Something else that we were provided through the Support Act that was passed a couple of years ago was a new section in the Food, Drug, and Cosmetic Act, 801U, which for specific identified active pharmaceutical ingredients, FDA can now consider an importation of that ingredient or a product that contains that ingredient a drug without having to develop any additional intended use, labeling type of stuff. If it's got that API in it, it's a drug, which really helps us move along in what we're doing in the international mail facilities, and really in getting to that determination of the product as a drug so we can get to our destruction authority. Another thing that we've been doing in the international mail facilities is we now have a satellite laboratory. So with our Office of Regulatory Science, specifically located at the Chicago O'Hare IMF. And there we can take unknown products, provide them directly, you can walk out into the parking lot, and they've got a trailer there with their laboratory. We walk out there, they test the product. If they find it's got an API in it, we can immediately move forward with our next steps of the actions. And we're now looking at the successes we've had there and then seeing how we can apply those in other areas. We've got international mail facilities, 9 of them currently across the country and in Puerto Rico. So if we can expand that to those areas, that will help us in our efforts to keep all of these illicit pharmaceuticals and other drug products from coming in through the mail. Okay, so on to what we've been doing for the last couple of years, and I'm really glad to be able to talk about this to you all because we're extremely proud of what the import program has done over the last 2 years. What we like to say is that when everybody else went home, we stayed because trade doesn't stop and international trade doesn't stop. I showed you the graph very early on. We had a slight dip in the amount of imported products coming in the US due to COVID. That only lasted a couple months, and then we were right back where we were pre-COVID. And so what that means is we had to remain vigilant in order for us to fulfill our mission. It also required us to remember the entirety of our mission. So we talk a lot about that our mission is to protect the public health, but our mission is actually to promote and protect the public health. But we're regulators and we're enforcers, and so we like to look at, we're going to protect the public health. We're going to take those actions. But during COVID, we were really called upon to help facilitate the importation of necessary, needed, and effective preventive equipment, therapies. We were neck deep in the vaccines and making sure that we could get those not only tested, but then also into the countries that they could be distributed to citizens. And your import program did just a tremendous job in fulfilling our mission during COVID. It required us to really think through, what we were doing. How do we continue on with our mission, this promotion and protection of public health, while also protecting our staff, fulfilling our obligation, like all citizens, especially at the early stage, and limiting interaction between and among people. How could we balance all of these different things? So we had to really prioritize our on-site work. We really looked at, we limited ourselves to the very highest risk products and the highest risk problem areas. We also needed to help bridge the gap that was created by all of the travel restrictions. FDA was no longer able to go and conduct our foreign inspections. And so how are we going to bridge that gap? We still needed to have oversight, of those firms and the products that they were sending to the US. And so we really targeted products that were coming from those countries, from those firms. And we expanded our use of our remote inspection tool. I'll talk a little bit later on about our foreign supplier verification program and what that's brought to us as an import program. But we were able to quickly develop a remote inspection program for FSVP and some of our other activities. Those things that were portable, we made sure to let our people do, but where we had to be on site, the border crossings, at the interior ports, we made sure that we were there, and our work in the international mail facilities continued as well. We had great focus on supporting our COVID response. Again, we had a large role to play in this facilitation of the needed equipment for our first responders and also for those firms that were developing therapies and preventive measures. The centers, Center for Biologics, Center for Drug Evaluation Research, Center for Devices, we're developing emergency use authorizations, that were all geared towards expanding access to different types of equipment. We had to, in the import realm, figure out how is the process going to work? What's the data that we're going to be looking for in response to these? And we worked very closely with the import community, the importers, the entry filers, so that everybody was on the same page about how to make entry in a way that we could get what we needed to then help facilitate those shipments. We also had to, at the same time, we're trying to get all of this product in, we still had to maintain that net, that coverage to keep all of this fraudulent product out, or the substandard product out. May come as a shock to some of you, but there were people out there who were solely interested in making a buck and were perfectly fine selling anything that they could get their hands on in order to make a profit. And we really had to work internally with our Office of Criminal Investigations and with our field staff, but also externally with Customs and Border Protection to get in front of these different kinds of products. And we saw at the time when everybody was looking for the ability to test, we saw literally hundreds and thousands of shipments of fraudulent, unauthorized, and just ineffective COVID test kits. We work with Customs and Border Protection to provide blanket support for seizure authority for them. We work very closely with our colleagues over at CDC to develop plans to test and authorize N95 and KN95 respirators so that we could make sure that those got in the country and got to the right people as well. And for hand sanitizers, we recognized early on that the opening up through an emergency use authorization for hand sanitizers brought in a lot of firms that were not used to dealing in the drug area, and perhaps felt that it was a lot simpler than it really was. And in fact, we ended up, again, with hundreds and thousands of shipments of actually dangerous products. Some reports up to 20 folks here in the US died from using these. Some of them drank them, which you shouldn't do anyway. But we really had to work very, very closely with Center for Drug Evaluation and Research and the government of Mexico specifically. We currently right now have an import alert in place covering all hand sanitizers from the country of Mexico, which is the first time we did a countrywide import alert for a specific category of drug products. But all of these things were going on again, I will keep beating this particular horse, is that when everybody else went home, we stayed. And I can't express enough the pride I have being part of that. We'll continue with that. We continue to work. We're supporting the White House initiative to get more test kits into the country. We're continuing to support the shipment and distribution of vaccines where necessary. We'll continue on with that as long as that. Now, actually, when the topic of this talk was brought up, Freda said, let's talk about supply chains. And I have kind of, without specifically mentioning it, all of this is supply chain. What we did during COVID is we found new supply chains, and we needed to assess those, and the ones that were good, we could allow to continue on. What we're doing, now with these import admissibility decisions is often we're looking at the supply chains that are there. We're looking to build in more of our knowledge of the product life cycle. And we have a better feel now that, the import entry process, that point where the product is coming in the country and information is provided to Customs and Border Protection and provided to FDA, is a point in a continuum for the product. And while we're leveraging that one point, we understand that there's a lot more that goes into it. How the product was manufactured, how it was stored, how it was developed even, and then how it's shipped to the US, and then where is it going and what's it going to be used for. We're expanding our thoughts about what imports looks like for FDA and for our import program and our coverage there. So one thing I wanted to talk about is an authority we received from the Food Safety Modernization. And specifically, a big game changer for us has been the Foreign Supplier Verification Program. At its simplest, FSVP now codifies the responsibility of the importer to know and understand the risks inherent with the products they import, and then to take steps to verify their foreign suppliers mitigating those risks. Historically in imports, we always talked about, importers, having a responsibility, but now it's in law, and now it's, covered by regulation, and now it's part of our regular activities in the import program. And it's important because it builds in that prevention piece to the products that are being imported. If the importer is fulfilling their responsibility and keeping track of the products they import and working with their foreign supplier to make sure that that foreign supplier is in, compliance with, if it's an LACF or an acidified food, that they're in compliance with those regulations. If they're covered by the produce rule or the preventive controls rule, both of which are also FSMA pieces, then we are going to end up with the safer US food supply. It also provides us much greater coverage of imported products rather than going back to that initial talk I had, where I have an individual looking at an entry and making a decision about that one particular shipment. Now, if I conduct a foreign supplier verification program inspection, and I have an importer who's checking all the boxes and taking care of their responsibility, I have a much better feel for the products that they're importing all year long and into the future. And same goes true if they're not compliant. And it lets me know that we're going to need to take more action based upon our findings from our foreign supplier verification program. We would welcome the ability to have greater authority in this area. And we'll continue to look for areas where we can expand upon this kind of idea of managing the supply chain. Quickly on the voluntary qualified importer program, this is what we like to call the closest thing to a green lane that FDA will ever put into place when it comes to imports. So under the voluntary qualified importer program, it's voluntary. It also is for food products like FSVP. For an importer who's compliant with FSVP, who has additional safeguards in place to include audits conducted of their foreign supplier, they apply with FDA. If they get accepted into this program, and there is a fee paid to FDA, they can be relatively assured that their products are going to be made preceded when they're offered for import. There may be times when we need to hold something and we reserve that right, but all things being equal, that's the closest thing that they're going to get to a green lane from FDA. And so this is another area where, as we look at the supply chain, we look at the totality of the circumstances around these shipments. If we've got everything we need to be confident that that prevention is put into place there, it just makes sense so that we can go focus our energies elsewhere. Some of the other things that we're looking at in the import program is how can we change up the way that we arrange the work? So one of the things I have on here is we're currently piloting a different way to conduct our entry review work. Again, that area at the beginning where we have folks looking at import data. And we just want to see, are there other ways to arrange the work, to approach the work, to make us more efficient and effective? Or can we identify additional areas for automation? So we can have our folks doing other work besides the entry review. We're looking at, under a national operations strategy, again, leveraging our knowledge of supply chains to then work with Customs and Border Protection and look for areas where we can insert and also understand a little better the world of these illicit opioid shipments and what we can do there. And then a really big part of what we're doing is this digitalization. Looking at, our predict screening tool, and like I said, we're constantly looking at it and looking for ways to improve that. We've started looking into ways that we might be able to apply artificial intelligence or machine learning to kind of help our system be more responsive and look at data in a different way, to help us again, become more effective and more efficient. I showed you the graph at the beginning that shows the volume of imports goes like that. Without giving away any trade secrets, I think I can say the resources applied don't necessarily keep up with that same graph. And so we just keep finding ways to get better at what we do, again, more effective and more efficient, so we can keep applying that level of consumer protection and public health protection and promotion as we keep going forward. I'll stop there. I think I've hit my time limit. Freda, I saw a few hands and.
Yep. Okay. So the first one, as soon as we started, you know who that came from. I'm not going to say who. So that question is, since the Bioterrorism Act of 2002 added several prohibited acts to the Federal Food and Drug and Cosmetic Act, has FDA used them instead of or in addition to relying on customs to simply issue refusals of admission?
Well, in addition to the Bioterrorism Act, we've had other authorities added since then. But perhaps one of the ones we're thinking of is our ability to debar importers and those that are involved in the process. We have for foods. We have issued a number of debarments, and actually CBP helps us to enforce those because those again call for holds at the border. We also now have debarment authority for drug importers, and we use that as well. So we're constantly looking at different ways to apply those authorities that we've been given. Obviously, if we receive authorities, generally they're ones that we've asked for, and we want to make sure we give that return to Congress when they provide them to us.
Okay. The next question I have here is from your previous supervisor. Are 321s, and please explain what those are 321s being done electronically now?
So 321s refers to Customs and Border Protection Section 321 entries, which are also considered de minimis entries. And so there's a less formal process for products that are now under $800 in value. And so the quick answer is Customs and Border Protection has now developed a system to accept those de minimis entries, those Section 321 entries. They have not yet made it a requirement. So it gets to be a little bit difficult for FDA to then make it our own requirement. And this is what's known as an entry type 86. It's a new entry type for those of you who follow such things. Customs is, and we are assessing the data we're getting from those. I think that the larger entry filers, the ones that deal with these mostly, and so again will be the couriers, your FedEx, UPS, DHL, they're seeing the value and the benefit of using the electronic system. But at this time, it's not a requirement.
Okay, same person, different question. During an FSVP inspection, why are investigators asking for the entry documents? The FSVP importer is not necessarily the importer of record. The FSVP importer may not have access to these records.
Well, if they are asking for specific entry documents, that would probably need to be made known. That's not part of the process that we've developed. So maybe this is a lack of understanding on someone's part. We can bring that back to the folks overseeing the program.
Thank you, John. And like I said, it was your previous supervisor. You know how to talk to. So here's an interesting question. Does PREDICT use artificial intelligence or deep learning?
Not right yet. This is something that we're doing right now, where we're exploring those different kinds of technologies kind of help us with our screening. We hope to keep moving forward with our screening and targeting. And we'll just have to see where that takes us. We did pilot, what year is this, 20? So last year, we did a pilot covering seafood where we definitely wanted to take a look at that. Got the data from that, and we're using that to help us move forward. And we'll probably continue to try different things to see what gets us the right mix there.
So I have a similar question. I have read about the use of artificial intelligence in the area of seafood, wondering how the assignment is coming along. It has been causing big headaches with importers.
Well, that particular pilot ended. And there were, it's like anything else that you're trying out, there were some things that we noticed during the pilot, and part of it was we started to see some importers were being targeted what seemed to be repetitively, and went back and adjusted. And I think that since, by the end of that particular pilot, we had addressed those concerns.
John, have you seen any changes to the prior notice program given all of the advances in import intelligence?
Yeah, I think just as far as the setup for the Division of Food Defense Targeting, they're really looking even more now at data analytics and how they're able to use the information available. There hasn't really been any, additional statutory authority, regulatory authority, anything like that, but just the way that we use the data, the conversations and the collaboration with Customs and Border Protection, I think just continues to improve the operations there as well.
So someone asked a question about hand sanitizer. So if a hand sanitizer is being held up, an imported hand sanitizer is being held up and tested by FDA, but the importer wants to retest, what is the process, and how quickly after results are submitted will FDA review and reconsider?
Okay, so when FDA collects a sample of an imported product, and then we're going to make a decision based on whatever those analytical results are. For an importer to say, I want to conduct my own testing, of course, they're free to do that and try to provide that as testimony. So let's say FDA collects a sample and finds methanol, which is not allowed in hand sanitizer. And the importer comes back and says, no, there's no methanol in there. I'm going to go have it analyzed myself. In order to refute the analytical results from FDA, it's not sufficient to just provide conflicting analytical results, but there's also going to need to be some explanation of, like, this is why we think the FDA results are wrong. And the importer has a right to those analytical results, and they can take a look at those, assess them, and provide that feedback back. But again, just providing conflicting results isn't going to be sufficient to overcome the appearance of a violation.
So I have several almost the same, so I waited to kind of make this almost the last one. They're pretty similar. And it's more statistics than anything else. Folks are looking for the percentage of line items or entries that are physically examined. And of those physically examined, how many have been violative in 2021, and how many have been made preceded?
Okay, well, I can probably start.
Questions.
I was gonna say, I could probably start with the big overall number, which is, like I said, we're at roughly a 66% system may proceed rate. So that's what Predict is releasing. We're, as far as like what I would consider like a nominal may proceed rate, which is that which gets released by the system plus what gets released with no additional action, probably up to around 95%. But again, you're talking, 46, 47 million lines of product. That's still a pretty good amount of stuff left over. I would say that, we, as far as the examinations and sample collections, historically, FDA has said that we conduct examination sample collections between 1% to 2% of the imported products. In full candor, I'll say it's probably a lot closer to that 1% than 2%. And then as far as the number of violations, refusals that we issued, that might be something I can provide back separately. That don't have that right in front of me. But it's not, as far as like an overall percentage, it's not very big.
And so do you know how many, do you have like how many were violative, of those that were physically examined?
I could get that back to you.
Okay. Do we have any statistics on where food testing exceeded the use date on the food?
Unfortunately, it does happen that, we might have a perishable food product that ends up being in the process longer than the shelf life. We go to great pains to avoid that. We do have processes into place for perishable items. Generally, if it does happen, it's often because additional analyses need to be conducted. I'll tell you, given the position that I'm in now, with direct oversight of the field operations, I would hear about it if it was something that happened on a frequent basis. I may hear about it once or twice a year, which doesn't do anybody any good if you're that once or twice a year. But we definitely work very hard to avoid that type of thing.
And one last question, you're right on time. So is FDA using the inspection reports from any other countries to modify predict scores? And what are the best examples of cooperation with regulatory authorities in other nations?
Yes, we do. We do take that into account. It depends on the agreement and arrangement we have with the country. But that kind of information does get fed into predict and help us with our screening and targeting. We also have the ability, and we do this to even be more direct, where we have used inspectional results from foreign government competent authorities to add foreign suppliers to import alert. We have some firms on import alert based on inspections that were done by a foreign government. So it depends on the type of arrangement we have with the country. Of course, we also have systems recognition arrangements that are far more broad than individual inspections, but those help drive our screening and targeting as well. So for those countries where we have those in place, that really helps us as we're making those decisions going forward.
Well, John, thank you so much. And how wonderful we ended on time. It's 1 o'clock. Thank you all for participating. John, thank you so very much for taking the time. I know how busy you are, so I really appreciate it. And please take care and all the best. And thank you from the FDA Alumni Association.
Well, I have to say thank you again for the opportunity. I like to brag about what the import program is doing. And
rightfully
really,
so.
I really appreciate seeing and hearing these names that I know, and people that I know have a vested interest in what we're doing.
Thank you again, John. And everyone have a lovely day. Thanks for participating. Goodbye now.